teaches about scapulohumeral function. Scapula forms this little V right here, right? So what you do is you take your thumb and your index finger and you put this right around the V, like that, and then you have them raise their arms straight up and out, and hold tight, don't let me push you down, and then we'll do it on the other side. Straight up and out, hold tight, don't let me push you down. What we should see is symmetry there. If we don't, so a lot of times when people have rotator cuff problems, some labral issues, some neck issues, the muscles that hold the scapula down on the back will not function correctly. That's what we call scapulohumeral dysfunction. So the reason that's important is because there are probably 30 or 40% of people that show up with rotator cuff issues actually have scapulohumeral dysfunction. So they're impinging, and they're impinging because as we move our shoulder, the acromion comes down and over because it's not being held in place correctly, and it's pinching on the rotator cuff muscles. So the reason that's important is because when you send them to the therapist, they need to know that really what they need to focus on is the parascapular muscles to stabilize it as opposed to the rotator cuff muscles, which yes, they can make them better temporarily, but if you don't fix that, they'll be back in your office again in 3 or 4 weeks because they'll have impingement all over again. So basically you can also see, so a lot of times I'll have somebody take off their shirt, I'll have them stand against the wall and lean forward, and if I see one scapula come up and the other doesn't, they're winging a little bit. And usually that's, although, in your basic sciences you learn winging is a neurologic problem, most of the time in clinical medicine, winging is because the muscles aren't holding in place correctly. And so you send them off and you tell the therapist scapulohumeral rehab, and they'll hopefully know what to do.